Everyone. Good afternoon, good evening, depending on where you're joining us from today. It's a pleasure to have you join us, and I'm very excited to share with you about the student experience in the Global Health Law LLM programs at Georgetown University. Throughout the webinar today, you will be able to drop your questions in the Q&A box. At the end of the webinar, we'll have some time to answer questions specifically, but please feel free to drop your questions as the webinar progresses. Just quick introductions. My name is Oloikwa Igbohare, and I am the Assistant Director of Health Law Programs and Capacity Building here at Georgetown Law and the O'Neill Institute. I'm also an alumna of the Global Health Law LLM. I finished the program in December of 2021. While I started in January of 2021, I was one of the COVID admittees. And since I graduated in 2021, I have worked at the O'Neill Institute. I also work with Marnia Tony, who is the program coordinator for capacity building at the O'Neill Institute, and whom you will get to meet more closely on campus during the LLM. For the benefit of those who have not participated in any of our previous webinars, before we jump into the discussion for today, I just wanted to share briefly about our programs. We have two health law programs here at Georgetown Law. We have the LLM in National and Global Health Law and the LLM in Global Health Law and Governance. We also have a number of different certificates that you can take to complement your program, and these include the US Health Law Certificate, the International Human Rights Certificate, Refugees and Humanitarian Emergencies, WTO studies, and a Food and Drug Law certificate. For the National and Global Health Law LLM program, students generally spend the entire academic year in DC and are required to take a limited number of credits. So that's a minimum of 24 academic credits for US trained lawyers and a minimum of 20 academic credits for foreign trained lawyers. Out of all these credits, foreign trained lawyers are required to take at least 14 specialization credits to graduate with the degree, while US trained lawyers must take at least 16 specialization credits. However, for both US and foreign trained lawyers, there's a mandatory 2-credit Global Health Law Survey course that just introduces students to the field and gives a general overview of what global health law is. Now, to make up your 14 or 16 specialization credits, we have an unparalleled health law curriculum with more than 60 health law courses. These courses are reviewed annually, and we make changes to ensure that we keep up with changes and developments in global health law. Following the COVID-19 pandemic and other public health emergencies since then, we introduced the Global Health Security and the Law course. We also have introduced public-private partnerships law and governance since the introduction of public-private partnerships to global health law. We also have international right to health and decolonization, global health and the law, which are both taught by a current and a former special rapporteur, UN special rapporteur on the right to health. And we also have biotechnology and the law, which is taught by one of our co-faculty directors here at the O'Neill Institute. I'd also like to briefly highlight some other opportunities that are available to our LLM students. Generally, health law LLM students have the opportunity to work as research assistants with the O'Neill Institute and health law faculty here at Georgetown. Research assistants generally support cutting-edge research endeavors at the intersection of health and the law. And our research assistants in the past have supported book projects, projects related to the pandemic accord, legal mapping projects related to universal health coverage, COVID-19 laws and policies, legal mapping for food laws and policies, and many others. I should also note that LLM students at Georgetown also have the opportunity to undertake externship placements at various organizations in DC. And in the past, we've had students extern at the World Bank, the Food and Drug Law Institute, the IMF, and on the Hill. We also have an LLM in Global Health Law and Governance, which is a joint degree with the Graduate Institute in Geneva. The Geneva end of the program is run by Professor Gianluca Borchi, who is an established expert in global health diplomacy and is the co-author of the Research Handbook on Global Health Law. As part of this program, students may pursue an externship or internship at a health law organization in Geneva or anywhere around the world. And students have in the past worked at the WHO or other United Nations agencies. And students are also alternatively able to write a thesis if they would rather do that instead of do an internship. So in this LLM program, students spend their fall semester in Washington, D.C., and then head over to Geneva in the spring. And these are the two of the health law capital cities in the world. And just like at Georgetown, in Geneva, students have the opportunity to take a broad range of different courses, which are offered and updated every year. Now, being in Geneva brings unique opportunities, including access to a strong professional network because of the location of the program, and also proximity to key global development agencies. It is a rare opportunity to learn at the seat of global health law and the home of the World Health Organization. And I'm also told that generally in May, students in these programs are able to attend the World Health Assembly, which I think is one of the coolest experiences of the degree. Our current students will be going deeper into talking about their student experiences, but I just wanted to share briefly some of the things that we organize for students while they are here on campus in Washington, D.C. Generally, we have monthly social activities where students get to connect with one another, get to connect with other people at the O'Neill Institute, our staff, our faculty, and other experts that are connected to the Institute. We also send out a weekly email that talks about the different events happening both on campus at Georgetown and at the O'Neill Institute. And students are generally granted access to all O'Neill and Georgetown law events. We also offer support for student-led events. So sometimes students decide to do something together, like visit a museum or have a bit of a gathering, and we are able to either provide space for that or some support in other ways. Some highlights of living in DC include, living, studying, working, only steps from the US Capitol, and also being able to connect with professionals working in politics, policy, and governance in DC. We have access to some of the most brilliant minds here in DC working on lawmaking for global health, and it's just one of the amazing opportunities that students get to experience here. Some past events that we have organized for students include a meet and greet with Professor Goodwin, who is one of our co-faculty directors, a panel with Dr. Tlaleng Mofokeng, who is the current United Nations Special Rapporteur on the Right to Health, a health law LL.M picture day. We also typically have annual hike and brunch events with Professor Goodwin and Gustin, who are our co-faculty directors. And we do an annual speed networking event for students to introduce them to the health law LL.M field and careers in health law. I just wanted to show this picture from our LL.M picture day. We all walked together from the O'Neill offices right on campus at Georgetown Law over to the Capitol to take a picture here. And these are some of our students engaging in discussion at the O'Neill Institute. I also wanted to share these pictures from the meet and greet with Professor Goodwin, the event with Dr. Tlaleng Mofokeng, a health talk that we do annually with Professor Gustin, and our health law LL.M orientation day back in August. We are also very committed to professional development. Our classes are designed to be intentionally small because we want to know each student, we want to know your interests, we want to be able to provide tailored advice. And so we put a lot of effort into professional development activities throughout the academic year. We, like I mentioned, organize speed networking events and other networking opportunities through brown bag lunch events, some career series talks that we also do as well. Georgetown Law also has an Office of Graduate Careers that is very dedicated and resourceful, and students generally get connected to them in their first few weeks on campus. We send out opportunities emails weekly that highlights internships, externships, job opportunities in the health law space. We also typically connect students who are interested in getting connected to mentors in the field, either at the O'Neill Institute or other people who are connected to us. We ensure that students get these connections early in the semester so that they have someone guiding them throughout their education. Students are also able to publish expert columns on the O'Neill website. That's especially for students who are beginning to develop thought leadership in health law, who would just like to publish or who would like to be involved in academia in the future. On an average, over the last 3 years, 93% of our students have gotten employed shortly after their LLM programs. And I think this just shows that we are committed to continuing to support students and our tailored approach to professional development works. In the last 3 years, our alumni have been employed at the World Health Organization, the World Intellectual Property Organization, Sidley Austin, Campaign for Tobacco-Free Kids, the Global Health Advocacy Incubator, Medicines Patent Pool, CDC, HHS, FDA, among many others. And this slide just shows some of our alums and where they currently work. Kanika is at the WHO, Eunice is at the CDC, Shreya is at the Global Health Advocacy Incubator, and we have Takuya at Johnson & Johnson. At this point, I will hand over to Karen Voland, our Assistant Dean for Graduate Admissions, who will briefly address the procedure for applying to the LLM programs.
Hi. So I'm thinking that some of the people who are attending today may already be admitted, but if we also have students who are thinking about applying to the health law LLM in the future, I will give you a brief overview of our application process. We have lots of information on our website, so there's no need for you to feel like you have to take detailed notes on what I'm about to say, but we'd be very happy for any of you who are thinking about applying in the future to take a look at our website or reach out to us if you have further questions after today. So basically, we have a rolling admissions process here at Georgetown. We usually open our admissions process in the fall, in the beginning of October each year for people who want to start the LLM program the following year. So right now we're in the middle of our cycle for people who want to begin the program in fall 2025. We opened up last October 2024, and we keep the application open really through several months and into the springtime, and we continually are reviewing applications and making decisions throughout that time until we have a full class. So we do encourage people to apply earlier rather than later in the process, because for a number of reasons. One is that the more seats are open at the beginning of the cycle, and then they get filled up as we go through the cycle. This also, it can often take, well, it does take a lot of planning for people to decide to do an LLM and make all of the arrangements that they need to join the program and come to Washington, D.C., both financially and logistically, and working with your current employers and things like that. So the sooner you apply and have that decision, the more time you will have to get everything together in order to join us in the fall. We also do have some deadlines that can help you through the process. The first is our early action option, which is passed for fall 2025. But if you're thinking of applying in future years, we usually, if you complete your application by the middle of November, we'll be able to issue you a decision before the end of December. We also have a priority deadline if you're not interested in applying through the early way. If you do complete your application by our priority deadline, which this year is February 5th, that ensures that you will be considered for scholarship possibilities. If you apply after that time, you may or may not be considered for scholarship possibilities. It just depends on our budget and where we are for that year with awarding scholarships. So try to get in by that priority deadline if you're not applying by early action. The items that you need to submit with your application are pretty straightforward. In addition to our application form, we also ask you to send in your resume or CV. We don't require a particular format for that, but try to make it easy to read, logically and chronologically organized with good details about the types of work that you have done and the dates and things of your work experiences and education. We also ask you to submit a personal statement that describes basically your interest in the LLM program or why you're deciding to take this step at this point in your career. When you are applying for either our National and Global Health Law LLM or Global Health Law and Governance program, it's not required, but we suggest that you explain your interest in one of those particular programs as part of your essay so that we can really see that it's a good fit for you. We ask you to include all of your higher education transcripts, so undergraduate and any graduate work that you've done. Please have your schools send those documents directly either to LSAC, which is one of our methods of applying, or directly to us if you're applying using our direct application. If you're a US trained lawyer, we ask you to have your school fill out a registrar certification form, which is something you'll be able to find on our website. It's fairly self-explanatory and is just a way for your school to certify when you graduated and how you did there. If you're a non-native English speaker, we do require you to submit a TOEFL or IELTS score that meets some minimum requirements, 100 points on the TOEFL or 7.5 on the IELTS test, and then 2 letters of recommendation. So those can be from professors, they can be from supervisors if you've been working in a professional setting. We don't have a preference or a requirement that you have one or the other or both, but the most important thing is that your letters be from somebody who knows you well enough, has worked with you closely enough to be able to describe your skills and qualities from their personal experience of working with you. We also do have the possibility of applying for our Global Health Law Fellowship program. So if you want to do that, you indicate that on your LLM application, and then you submit a supplemental essay of no more than 500 words on an issue of health law or policy that's of interest to you. And if you wish to include a statement of financial need with that, you can as well. Those scholarship decisions are made separately from the admissions decisions. So first you would be, if you are admitted to the program, you would receive your admission letter, and then the scholarship decision is made later in the process by a special committee that takes a look at all of our global health law fellowship applicants. So if you're an admitted student right now and you're wondering about scholarships, that process has not yet begun. And you will find out more about that as soon as our Global Health Law Fellowship Committee has had time to assess those applications and make some decisions. So that's pretty much the admissions process in a nutshell. You can always reach out to our office at lawllmadmiss@georgetown.edu. I will put that in the, I don't know if I can put it in a Q&A, but you can also easily find the contact information on our website. So feel free to reach out to us if you have any questions.
Thanks, Karen. And yes, if you have any questions about the admissions process as well, Karen will be here till the end, so you can drop your questions in the Q&A box. Now we're moving on to our panel discussion with our current students. I am really grateful to you all for deciding to share your time with us today. And we have an incredible lineup of current students in the Health Law LLM program who have graciously agreed to share their experiences with you and answer any questions that you might have. Just like Karen mentioned, I know that there might be some people online who have already applied and gotten admitted. So feel free to ask questions about, any logistical questions that you might have. We'll do a few more of these later for admitted students specifically. But if you're also still on the fence and thinking about whether or not you should hit submit on that application, you're also welcome to ask questions. Without further ado, let me just go right into it and ask our panelists to introduce themselves. Tell us where you're from, who are you, and why did you decide to pursue the LLM? And I'll go in the order you guys appear on my screen. So starting with you, Ty.
Thank you, Olo. My name is Ty. I'm a health LLM, obviously, with the O'Neill Institute, and I'm from Arkansas. I practiced law for about 6 years in the state of Missouri and didn't find it particularly satisfying, especially the subject matter that I was dealing with. It was very sort of just a mundane practice. I loved the people that I worked with, and I didn't have any complaints about that. But I was sort of looking for something more engaging and aligned with my interests. So I started looking at things that were very personal to me and things that I sort of prized. And personal health was always a big thing. And I just sort of had an itch to work in a field that I could help others prioritize that in a way that would be rewarding for them. And health law and policy was something that stood out to me. And Georgetown was obviously very well positioned to serve my interests. So it was a pretty short hunt for me to figure out where I wanted to be. And truthfully, Georgetown was the only application that I submitted. Luckily, I got in and it all worked out. But maybe I don't advise that for everybody, but it worked out. I'm glad to be here, and it's been a very rewarding experience.
Thank you, Ty. I'll move over to Sar.
Hi, everyone. My name is Sar. I'm from Israel. I'm from Tel Aviv. Prior to Georgetown Law, I was the head of government affairs for a local HMO back in Israel. And before that, I worked at the United Nations headquarters in New York. And my interest in health began more or less in that area of time. It was the aftermath of COVID. So during my time at the UN, I dealt with the global response to pandemics, vaccines affordability, accessibility. And after a few years in my previous position, I decided that it's time to level up, to look for other positions and opportunities abroad. And then eventually, when I discovered this health law program, it felt like it's a meant to be program for me. It was exactly what I was looking for. The opportunity to learn from the best minds in the health law field and the really holistic and broad opportunities of classes to choose from. I think it's unparalleled, really. And I'm super glad I made this decision and I came here to Georgetown Law.
Thank you, Sar. We are happy to have you as well. Geeta?
Hi everyone, I'm Geeta. I'm from India. I just finished last year. I finished my undergraduate in law degree in law, and during my law school experience, I developed a really strong interest in health law, and I gravitated towards this particular program because almost all of the articles I read in global health law are written by someone associated with the O'Neill Institute. It's like the leading institute for research in health law. And I'm in the Global Health and Governance program. So if you have questions about the Geneva part of the program, or if you have questions about how the dual program works, I'm happy to answer them to the best of my ability since I've not yet left for Geneva. But yeah, I ended up pursuing the LLM because I was really excited to learn from people I've read so much about. And that's definitely something that I got to experience here at Georgetown. All of my courses were really academically and intellectually stimulating, and they were with people who were leading researchers.
Thank you, Gita. Valeria?
Thank you, Olo, and hi, everyone. I'm Valeria. I'm from Bogota, Colombia. And before arriving at Georgetown, I worked at an international human rights organization, doing strategic litigation and advocacy around sexual and reproductive rights in Colombia and Central America, the Dominican Republic, Venezuela. And in that capacity, I got to work in partnership with members of the O'Neill Institute. And it was a really rewarding experience, very stimulating. I got the chance to, for instance, design workshops with the O'Neill Institute and facilitate them, and also work together in several projects. So I got to learn a lot from that experience. And I got to a time in my career where I also wanted to like step up and learn more about the field in sexual and reproductive health. I wanted to deepen my knowledge also in international human rights mechanisms. So I was also interested in pursuing a certificate in international human rights. And also I wanted to expand like my professional network, and I think DC and the O'Neill Institute is a great place to do that. I kind of just from browsing the website and participating in events with the O'Neill Institute, I saw that it was going to be a place where I could really find the support to develop my professional interests and my career, and just to receive like very customized advice on how to pursue my goals. And those expectations have been met. And I was also very interested in learning from a diverse community. So the faculty at Georgetown is from like different countries and regions in the world. Also, my peers come from, and my classmates come from different regions. And that experience has allowed me to learn from different contexts. And I'm really glad that I decided to join Georgetown Law.
Thank you, Valeria. Over to you, Mumbi.
Thank you, Olo. My name is Judy Mumbi, and I come from Kenya. I practiced in Kenya for around 4 years, and I was in the area of corporate, commercial, intellectual property law, and a bit of innovation here and there. My interest to pursue health law came from a very young age. I can tell from around 10 years ago. I wanted to be a doctor. That didn't work out. But I said, if I'm not going to be a doctor, I'm still going to work with the doctors. I'll find a way to work with the doctors. And as I was pursuing my undergraduate degree, I was very intrigued with things to do with medical negligence, anything to do with technology when it came to the cross intersection between health and technology. So that passion has carried me through. And I was very particular in finding a university that would hone my interest and passion. And I didn't know much about Georgetown before. So from just doing research for years and years, it kept propping up year after year. So I said, why not? Interestingly, I applied to 5 universities and got in. So now I had a tough decision to make. I would have been probably in London or the West Coast, I don't know. But I am grateful for Georgetown because they offered a very good landing for me, especially the scholarship that was offered. And we'll talk more about the opportunities I've gotten so far. But that's why I pursued Health LLM. I still want to work with the doctors today. Thank you.
Thank you, Mombi. And yes, we are all here hoping that you get to work with the doctors. So I will stop sharing my screen right now just so that we can have a bit of a more intimate discussion with the panelists on the screen. And I just want to ask you all, what or how has your experience been so far in the LLM? I know that a few of you have mentioned some things that you have gotten to do or some details about your experience, but I just wanted to ask if you can shed a bit more light on how your experience has been in the LLM. I'll start with you, sir.
So first of all, it's all about the people for me, and my colleagues, my peers, my friends in the program is really what for me makes this year a once in a lifetime experience. Obviously, DC is a great place to be. It's a lively city. It's a fun city. Everything is close by. I live a few minutes from the law campus, and it's very easy to walk everywhere, basically in the city. You have bicycle lanes all over the city. Public transportation is pretty easy. I'm a big fan of live music, so there was always a good concert to see, and sports activities. First of all, in the law campus, if you want to play, there are like soccer groups, football groups, basketball groups. I play pickleball every week with a few friends. At the law campus, there's like a big complex, so it's very accessible. And also sport to watch. There is like NBA, football. So if you are a football and sports fan in general, it's definitely a good place to be. Also, it's more affordable when you compare DC to other cities such as Boston or New York. So that's also a big plus about Washington, DC. This year was an election year. So for me, it was a big experience to be here in Washington, DC, where all of the action is happened, the rallies, the events, the sessions. Also, as an Israeli, it was a very inviting place. So that's also an important thing for me to mention. But eventually, I think just the people in the program are like-minded people. All of us come from a very rich and vast experience in the health law field. All of us have, obviously, health law is broad in itself, but all of us want to pursue basically the same goals. We want to help other people have more healthier lives, accessible drugs, medicine, medical sessions, centers, really everything you can mention. So I think that if you're interested in health law, this is really the place to be. To be in a specific niche, eventually it's a big advantage. In a specific program, for me, this is really what made the difference. Eventually, other schools, most of the university have a general LLM, but in Georgetown, this specific program and these specific people that you're going to study with, it's really what made me choose Georgetown over other places, and I really, really recommend.
Thank you, sir. Gita?
The last semester for me has been absolutely amazing. When I joined the program, I was expecting the coursework and the network and the research experiences to be really, really good. And they definitely met and exceeded those expectations. I have had classes where I've been able to work on actual things, like practical classes. I've had classes where I've been able to write papers which have been guided, and um, I've received like inputs. I've had classes where I've learned so much in such a short span of time, and it's much more than I learned in all of the years I was doing research on my own in the field. Um, and there were so many things that were new for me joining the LLM program. I think like Sar said, the people was just a very unexpected and amazing experience to have. My classmates, our professors, and just everyone at Georgetown is such a close, tightly knit community that I feel really supported. I think something that I also wasn't expecting was the amount of support I've received in my um, quest to like build a career in health law, because I came from a place without a lot of work experience, and I was really nervous about like getting a job and getting a career. And the O'Neill Institute and Georgetown are really helpful with career services, which I think was a big plus for me. And another thing that I really appreciate about the program and about my semester here has been that we are involved with everything that happens in Georgetown. If there's an event happening on campus, if somebody is visiting, if there's a seminar happening, we get that invite and we can go and attend and um, meet new people and learn new things. And not just on the Georgetown Law campus, but we have access to all of the events happening on the Georgetown main campus as well. I was able to take a class on global health security and diplomacy with the Georgetown School for Global Health Science and Security, and that was an amazing course, and I would highly recommend it. So yeah, I think like what's really made the experience so great is how everybody over here is rooting for you to do well and to get what you intended to get out of this program. That's something that I didn't expect, and I was really happy to.
Thank you, Geeta. Valeria?
Well, I agree with what my friends have said. For me, being part of Georgetown and doing this LLM has been like being a part of a community. Of course, I won't lie, things can get intense and there's a lot of pressure and coursework and deadlines, and it's heavy work, but at the same time, you feel like you're being taken care of and you have someone to reach out, and the O'Neill Institute really puts a lot of work into making us feel welcome and just to feel like we can reach out in case we need help, we have doubts. And this, for me, I had this feeling before deciding to enroll at Georgetown because, for instance, in my case in Bogota, Georgetown did like an event with admitted students. It was in person, and we got to meet each other. We got to ask questions, and that was really something I didn't get from other schools, which where I was admitted. So that was for me very telling on how I was going to feel being part of Georgetown as a student. And those like expectations have been met. It's really, classes are small, you feel comfortable asking questions. Of course, there are other classes that are large, but professors are very accessible, and you can just reach out in case you want to ask for advice, and that feels really good, especially taking into account that yes, like classes are intense, that you're stressed about, your career, what are you going to do next? So it's really nice to feel like you're being taken care of in that, yeah, in those situations.
Thank you, Valeria. Mumbi?
Thank you. I'll also break mine down into the social and the school life, and I'd like to start with the school life. For me, one of my main goals when I was joining a master's program, ideally whichever area I would have ended up in country, I was focused on learning to research better and write better. So I was pleasantly surprised when I joined Georgetown that I was really going to actually research and write a lot. So I found myself in classes where we'd have to write something every end of the week. And the first few weeks, I was struggling with it. I'm like, why do we have to write every single week? I was like telling my classmates, I don't want to do this, but they kept pumping me up. kept encouraging me. So week after week, I was like, okay, it's not that bad. It's not that bad. At the end of it all, I wrote a 30-page paper, and I couldn't believe I did that. Like, having not practiced health law ever in my entire life, I did not believe I could have written a whole 30-page paper. And that's one course. I ended up writing for 3 courses. So I actually enjoyed the journey at the end of it all, and I'm more intrigued to do it now in this semester. So for me, the academic life has been to just push myself beyond what I thought I could do. And I am grateful to have had a very good support, especially from the people we can see on screen here and most of my friends behind the screen. So that has been the best part for me. And when it comes to social, we love the people. I love people. We've cooked together. We've had dinners together. We've gone out together. And it's not just the Health LLM program. I have friends from all programs. Some have invited me to their houses, cooked for me. Some have taken me to their favorite restaurants. I've learned Japanese, Chinese. I've learned Hindi. I've learned Spanish. Yeah, so I have friends from all over. That beats nothing else. If I will spend money again, I will definitely spend money on the people. But something else I love about DC particularly is the museums. We have over 17 museums, and guys, they are free. That I did not expect. I did not expect that I'd walk into a free museum in the US and like spend hours just looking at it. And the best part is one of my best museums was thanks to the O'Neill Institute for taking us around the African American Museum, and I didn't want to go back home. So such enjoyable moments, like you get to go to your professor's house, enjoy dinner, you get to go for a hike with your professors and the other students, just enjoy, you get to go to a museum with them, you get to just hang out and don't feel the pressure. That for me is timeless. So I have really enjoyed, and I hope anyone who chooses to come to Georgetown, just come and enjoy, be ready to work, but also be ready to play. That's the balance we need in life. Thank you.
Thank you so much, Mumbi. I'll hand off to you, Tai.
Thank you. I can't really say anything more beautifully than my colleagues have here, so I'll just try to hammer home a couple of the points. Everything that you need to succeed in this program is here. The support, the resources, the connections, and everything is at Georgetown. It's here. It's you don't have to worry about that. Things that you need to stay healthy, socially, mentally, and physically are all here. The fitness center is great. The curriculum is very diverse and expansive. And I really just want to hammer home a specific thing that it will take me too long to appreciate. But the social aspect, you heard all of my colleagues here on this panel talk about the friends in the group and the people that you get to work with day in and day out. And if I could do it all over, there's a movie called About Time where a guy, he can essentially time travel, but he lives every day twice in a row. The first day he goes through worrying about everything that's, the pressures of work, interactions that he has. He doesn't really value them because he's so preoccupied with the weight of life, and things just pass him by without him really appreciating them. Then he lives the day again and tries to appreciate all of the tiny little things and the moments with people and things of that nature. So like Moonby said, if I could spend the money again just for the people that I've interacted with, no question. My colleagues know this about me. I typically just I kind of keep to myself and don't really go out much and do anything. And I know I'll regret this, but I'm just the kind of person that's so tightly wound that I focus on the wrong things sometimes. And it, like I said, it will take me too long to learn this lesson. But everybody in the program has engaged or interacted with either the course or me directly in a way that I remember each of them, like specific moments in speaking with them. Everybody on this panel has said something in class that I concretely remember. And as they were speaking, I went through and sort of just appreciated those memories for a moment while they were talking. There are people in the program that I've said less than a handful of things to that I still think about every day. And that's not exaggeration. That's the whole truth. So all that to say, don't worry so much about whether you will be supported in this program, because I can tell you, like my colleagues have, that you absolutely will be. Just try to appreciate what's happening while it's happening. And that way you can sort of get the most rewarding experience that you can, I think.
Thank you, Ty. Thank you all so much. I feel like now I am sold and I want to apply for the LLM again just because of what you all have said. But thank you for sharing such deep thoughts. I think it's very useful. You've shared some very useful nuggets. And I know you have touched on this a bit, but I wanted you guys to share maybe your one highlight from the LLM program that you would like to share with people who are thinking of applying or who have just gotten admitted to the program. Let me start with Gita.
One highlight that I can't choose because there's so many amazing things that have happened, but I think one thing that I would really like to highlight is this particular course that I took that was, I think, like the most professional development that I've had in my entire life. So I took this course called Global Health Diplomacy, and it's taught by Professor Rebecca Katz, who is a global health diplomat with the US government. And the course was structured in, so we had three things. We had classes, and then we had negotiations, and we had written submissions as part of the grading system. So I got to like benefit from this wealth of experience that Professor Katz brought to class, her own personal experiences as a global health diplomat, and all of her knowledge and research. And then I also got to apply that through negotiations, and we had negotiations on the pandemic agreement, we had negotiations on the Biological Weapons Convention, and we had negotiations within a government where we were responding to an outbreak. And I wrapped up that class by writing a paper about the pandemic accords that was a very academically fulfilling experience. I've never been as satisfied with something that I've written before. And I think that's something that's been the highlight of my experience. Amazing course, amazing professor. I was really, really lucky to be able to do that, especially since it's not a law course, but it's a course offered by the School of Foreign Services and the Global Health Science Institute.
Thank you, Gita. I think that's a very important point that you made about being able to take classes even beyond the law campus. In the past, we've had students take classes on the main campus, on Georgetown's main campus. And this year, we also have students taking classes in the McCourt School of Public Policy. And so, you know, when you get into Georgetown Law, you don't only get access to the faculty and resources on the law campus or at the capital campus, you also get plugged into other campuses, including the School of Foreign Services that Gita spoke about. And, you know, as someone who is building a career in global health law governance, I can see how important that course was to you, Gita. So thank you for sharing that. Sar?
Thank you all. Well, it's truly hard to choose. So many great moments and memories that I will really cherish with me. I think that last week we had a gathering for the O'Neill cohort, the health law cohort. We had pizza. You know, it was a great opportunity above all to meet everyone after a winter break. Gita is leaving us to Geneva, so it was a great chance to say goodbye as well. But winter break was, I think, 2 weeks, and I really felt that I missed all of my friends here. I went back home, and coming back here and having the opportunity to see everyone again, catch up over pizza, which is always, of course, great. But eventually, this is exactly a moment that captures the program. You have an opportunity to be surrounded by people that are like-minded, are great scholars, and always have interesting insights and papers that are writing about and opportunities and connections. And obviously in the health law field in the future, they will always be able to help you. And, after a long semester, which was hard and intense, as my friend said, that was a moment when the semester has just started. You're not as nervous as you will, and as we all will be in a few weeks. And it was just a great moment to enjoy with each other. And I'm looking forward to the next events as well. And please feel free to reach out and ask messages. I'm available on LinkedIn. So if any one of the participants have additional questions, I'm more than happy to answer. So feel free.
Thanks so much, Sir. Ty?
Thank you. As for a single highlight, I have one in mind, but I'll save it. The whole experience is kind of just overwhelmingly positive. Yeah, there are pressures and it's a lot of weight that you feel. For me, the program being a year long in itself is kind of like it's an extra stressor, just because I feel like I want to do everything and do as much as I can in the time that I have here. I think if I could put it in broad terms, the real like highlight is just I hate to always go back to the people around you, but yeah, it's the friends that you have here with you, but it's also the minds that you get to interact with in the health law space. And I came into this program sort of not ever having really practiced in health law directly. I was doing more general practice work in my career, and so it was kind of like I guess the warm-up period was very brief before you're in the room interacting with people who are already, they're already neck deep in health law and they know every facet of it. If you have questions, they're there with answers. Something I've had to realize is that some of the best ideas that I've had on my own were ideas from years ago. They've already been tackled in the field, and it's sort of just realizing that there's a lot that goes into it. And there's a lot that I feel I need to catch up on a lot of the times, but it's, you have opportunities to do that here, and the people around you can definitely support you in that. So my specific highlight, I guess, in an academic sense, appeals more to my vanity, I guess. I was taking a World Health Organization class taught by Professor Birchie, who is the former WHO legal counsel, and we were discussing litigation strategies around the different interactions within the WHO. And I raised my hand thinking that I had a good idea, but I wasn't sure, but nobody else was raising their hand. So I pitched it, and Professor Birchie said that I made a very elegant argument and that he would have to remember it. And I made a note in my little notebook that said that I did that on that day. And whenever I'm feeling down or feeling like I'm not really doing as well as I want to be, I can pull out that notebook and look at that page and remember that at least once I did something that someone who I respect found to be great. So that's my one tiny little moment for you.
That is a very profound one and very sweet of Professor Borchi to say as well. And I'm sure your intervention was wonderful. Thank you so much, Ty. Mumbi?
I'm equally struggling to pick one highlight. So, but in the academic sense, the classes I took were very mind-blowing, because you know how you think you're going into a classroom and what you read in the textbook is what is actually the law. Then the professor challenges you to think beyond what is actually just written, like question the law itself. Like, is this what you'd want to do, like in your own country? Would you want a similar law in your own country? That's challenging my mind every time I thought of something. That was a highlight for me. And just outside that, coming from East Africa, never having experienced any seasons, this girl got to see snow, and guys said snow will not come that much in DC. I was swimming in snow. Gita can tell you, I was the most excited that day. I didn't want to go to class. I just kept looking outside the window. I wanted to be in the snow, live in the snow, until I learned it's too cold to stay in. Then I had to go back. Yeah, so that for me was the highlight, seeing the snow. As simple as that may sound, it was my highlight.
No, that is totally understandable. My first experience of snow was in the US as well, and in Indiana. And so I know it was a lot of snow this year as well. So it was a good year to experience it. And I hope for the sake of some
Our internet is down. Maybe Dean Karen, you can help us.
I think something is a little weird with the internet, but hopefully folks can hear me. I just thought it was nice to hear what everyone's highlights are. I got asked a similar question about my role working in admissions the other day and whether I had a highlight from my many years of doing this job. And I'll just say that this type of webinar is such a highlight because I wouldn't do what I do if I didn't hear how students who come here for the LLM are taking such great advantage of the program and getting so much out of it. So I think it was great to hear from all of our current students about their experience, and thank you for sharing those, and really happy to hear how your year is going.
Thanks, Karen. I know I froze at some points, but I don't know if Valeria got to share her highlights.
I didn't. I'll be very brief. I agree with what my friends have said, but I also wanted to highlight the opportunity of being a research assistant with the O'Neill Institute. I think that's a great way in which the Institute also supports students, not only by allowing them to engage with staff members of the Institute that maybe aren't professors, but that they're people who you're interested in working with. And also it's a great way in which the O'Neill Institute supports financially students, with which I know it's an important concern for international, but also, well, maybe all national students who want to just maybe have an additional income. That's also something I was a research assistant last semester, and I was very grateful about that opportunity. So I would highlight that as well. Besides from the also very generous scholarships that are offered at Georgetown Law.
Thank you, Valeria. And thank you all so much. I know we are at time. I don't see any questions in the Q&A box, but I'll give it one more second to see if there's any question from anybody. If you would just like the panelists to respond to any of your thoughts about the students' experience. But thank you all so much. I feel like you already hit most of the questions that we planned to discuss, and I know that you are open to having students reach out to you on LinkedIn and other platforms if they have any follow-up questions. So please feel free. I think you can connect with me on LinkedIn if you have any questions, and I can put you in touch with any of our panelists, or if you take down their names, you can also connect directly with them on LinkedIn. Thank you, Karen. Thank you, everyone, for joining us. I have taken note of some of these names, and I hope to see your applications come through in the next couple of days and weeks, and hopefully see you on campus in this fall. Thank you so much, and have a good rest of your day, night, and week. Bye, everyone.